Trump administration's efforts to shrink the federal government and cut government spending is impacting public health. The administration is expected to cut about 10,000 full-time jobs across the Department of Health and Human Services. Some of the agencies included in the cuts are CDC, the FDA, and the National Institute of Health. Health experts say the cuts include divisions responsible for tackling cancer research and improving minority health. It's part of a wider plan by the new health secretary, Robert F. Kennedy Jr., to reshape the federal public health sector. Now, this is all happening as the Trump administration also cuts funding for dozens of HIV-related research grants. These cuts are on top of previous slashes to USAID funding used to help manage HIV beyond just the U.S. Additionally, officials are reportedly considering the elimination of the CDC's HIV office and its funding, most of which goes to state and local health departments and community-based organizations, as CNN reports. I sat down with 9 News medical expert Dr. Payal Kohli to discuss how these cuts could impact lives and future health research. All right, Dr. Kohli, thank you so much for joining us today. This is such an important conversation, so I appreciate your time.
Yeah, it's really important. I mean, it has all the physicians on the edge of their seats looking at really what the impact is going to be.
Right, and that's exactly what I want to start with. So we know that the Trump administration has cut dozens of, studies and grants that focus on HIV. As a medical professional, why is this concerning? What does this mean for the people who already have HIV or who are at risk?
I am concerned because the fight against HIV, I feel like we have been winning more recently, and these funding cuts may hurt us in the sense that we may start now losing that fight. We still don't have a cure for HIV. We've learned how to turn HIV from a deadly diagnosis into a chronic illness, but I still think we have work to do. And if you think about all the people out there that have HIV right now, the impact would be tremendous. I mean, we're talking about impact on access to treatment and therapy. So a lot of people actually rely on government support organizations to pay for their antiretroviral meds. And we know because HIV lives inside your body all the time, you need those medications to keep the infection at bay. So I'm worried that some people will lose access to the antiretroviral therapy. I think the stigma around HIV, which had started to abate because we had now turned it into a chronic disease, is now going to start to wake up again because of these funding cuts, with people having less support services, people having less education around HIV, and people really understanding less that HIV is not something that's contagious that you can catch just by sitting next to someone. Those types of educational messages, I think, will start to get lost. And I do think that the people that have HIV or the people that are at risk for HIV, the preventive efforts may also get impacted. The data tells us that 13% of Americans that have HIV don't know that they have HIV. Right. And so you're talking about, those types of patients walking around out there infecting others. And if you don't have access to post-exposure prophylaxis, pre-exposure prophylaxis, those preventive meds, that would be huge as well.
And I think that something that's also very crucial in this is the communities that are more at risk of being infected. So we know that that includes queer men, especially queer men of color. And that's a group that already has a lot of barriers when it comes to getting access to medical resources. How might this impact them, especially as a medical professional?
I mean, I think it's going to be a disproportionate impact. And HIV is one of those diseases that discriminates because, as you said, not only is it more likely to occur in those communities, it's more likely to be undertreated, it's more likely to have more severe consequences, and it's more likely to occur with other sorts of conditions like substance use, homelessness, all of the other types of things, the social determinants of health, how you live your life that can impact how long you live your life. And it shouldn't be that who you are, the color of your skin, where you live, whether you are homeless or not, should impact how long you live. And yet I worry with these types of funding cuts, that's what's going to end up happening because those are the people that are going to experience a disproportional decrease in access. It's not going to be the wealthy, insured people that have access to medications and access to doctors. And already, if you think about the wait list for many doctors out there, I mean, the lists are huge. And if you're living with HIV, you need to get in to see your doctor on a regular basis to get your viral load, your CD4 count, all of those blood tests checked to make sure the HIV is behaving itself. Right. And if you start doing funding cuts, I mean, that's going to mean less doctors' offices are available to provide support to these types of communities.
With that, the NIH told CNN that a lot of these cuts had to do with Trump's executive order that has to do with cutting things that don't necessarily go along with the American people's best interests, or that have a lot of money allocated to them that leads to a lot of spending. What would you say to that?
Well, I would say that the people that are arguing for the cuts are arguing for them because they're saying we're in the best place we've ever been with HIV. We've turned it into this chronic illness, and now is the time to think about peeling back the funding, strike while the iron is hot. But I think that's a bit of a short-sighted view because it's not just America in isolation. We're really talking about the global impact of HIV, and thinking that just because it's in Africa or it's in other parts of Asia, not here in the US, doesn't affect us, I think is the wrong way to think about it scientifically. Because if you think about HIV running amok in sub-Saharan Africa, which might happen as a result of these funding cuts, that means you're getting more viral resistance. So those antiretroviral meds that we're using in our Americans may start working less effectively because it's telling the HIV to evolve so that it starts getting resistance to those meds, because the more the infection spreads, the more it mutates, the more it evolves. So I do think that it's a short-sighted way of looking at things, because even though the impact of HIV in America is less than it is in other parts of the world, this really is a global health problem. And we all need to work together. And it's one of those diseases that I call the great unifier, because it's actually brought together many countries, made us think about globally how to address this epidemic rather than just focusing on the United States. And so I think this particular perspective is a bit of a step backwards.
Absolutely. And I was going to ask you about the global impact. We know that there's already been impacts in centers in sub-Saharan Africa, for example, that have been affected by suspensions and pauses to aid. What does this mean for global research moving forward? Can this have a ripple effect for other research regarding other diseases?
Very much so. In fact, I think HIV was one of those diseases scientifically that taught us so much about the immune system, about vaccines, about stem cells, about all these different types of scientific questions that didn't just help inform HIV, but actually helped inform vaccine development in other areas, helped inform how we think about immune diseases and autoimmune diseases, how we think about chronic infections, even heart disease, actually. HIV has taught us a lot about heart disease. So I think the fact that HIV funding is going to get cut is going to have a huge impact on many other aspects of scientific research. And I think globally, unfortunately, we're going to see more and more people now developing AIDS, dying of AIDS, and dying of many of the complications of AIDS. Again, that could impact us as Americans, including tuberculosis, including other multi-drug resistant infections, including cancers that occur when you're immunocompromised. So you're actually waking up a whole host of diseases that we had sort of gotten control of if you let HIV start to progress to end-stage AIDS, because then you're talking about TB being more aggressive, you're talking about Kaposi sarcoma being more aggressive, a lot of the other conditions that go with end-stage AIDS. So I'm really worried about the impact of this in the long term. Could we dial back the funding for HIV? Probably a little bit, but I think these types of dramatic cuts are really going to impact not just us here in the United States, but people all across the world.
Absolutely. What, if anything, can people who already have HIV do now moving forward?
I think it's really important to be proactive, because we don't yet know as physicians and as the medical community how this is going to impact clinical care, how this is going to impact research, how that's going to impact access to medications and prevention programs. So I would say the first step, if you have a doctor, talk to your doctor about how you can continue to sort of protect yourself, whether it's because you're, sexually active queer man who might have a high risk of exposure, or because someone who's already chronically infected who needs to think about sort of staying on top of their risk prevention. Because the last thing you want to do is play catch up, is fall behind, and you don't know what's coming. So I think the first step is to really sit down and talk to your doctor. The second step, I would say, is really try to get involved in some of the advocacy groups and the support groups, because creating a community around HIV is going to not just help on an individual level, but I think it's going to help moving forward in people really recognizing, even if they don't have HIV, that it is a problem that can affect all of us in many different ways, and we all need to put our support behind it.
Absolutely. Dr. Payal Kohli, thank you so much.
Thank you.